Thank you for coming at such short notice. Ernie, Oxford MPP, had asked that we gather here today, that Ernie would like to have a little discussion with us. So with no further ado, Ernie, the floor is yours.
Well, thank you very much, Perry. And I just want to point out that I wasn't lost, but you can't make your grand entrance if you're the first to arrive. And so that's why I just went back out to make sure that I could make that grand entrance. But I'm on behalf of Premier Ford, Deputy Premier and Minister of Health Sylvia Jones, and the Ontario government, I want to thank Woodstock Hospital for hosting us here today. It's a great pleasure to be here, and it's nice to see Mayor Accioni, Hospital President and CEO Perry Lang, and Patricia Hilderley, Chair of the Hospital Board of Directors, and Marcus, the Warden of Oxford County. Thank you very much for all being here. I'm excited to join you all to share another way out. Our government is making it easier for people to access care and support they need close to home. Under the leadership of Premier Ford, our government has been making record investments in health care to build a system that puts people at the heart. Taking bold and innovative action to connect families to the care, treatment, and support they need when and where they need it. Through our government's roadmap to wellness, we are investing $3.8 billion over 10 years to fill gaps in the mental health and addiction care, create new services, and expand programs. As part of the 2024 budget, we were investing more than $500 million over 3 years to create more supportive housing to address unstable housing conditions for those experiencing mental health and addiction challenges. And we're continuing to improve access to mental health support services across the province by creating 550 more addiction recovery beds, adding 100 new mobile crisis response teams, and expanding our youth wellness hub network to bring a total of 32 open across the province since 2020, including one right here in Woodstock. Today, I'm excited to announce our government is continuing to build on the progress we have achieved to connect more people to the treatment and support they need when they need it, while continuing to build safer communities by approving 18 new homeless and addiction recovery treatment hubs, including one right here in downtown Woodstock. These 18 new hubs are being in addition to the initial 9 drug injection sites that are transitioning to HART hubs, bring the total number of new hubs to 27 across the province. The 27 new HART hubs will be supported by our government's $529 million investment. And each of these new homeless and addiction recovery treatment hubs will have a goal of being operational by April the 1st, 2025. Some of you may think that's a little fast. But the truth is, the ones that were addiction sites that are now being treatment facilities are operating and will continue to operate, and they will be meet that deadline. I don't expect we will be able to quite meet that, but give it an extra month, we'll be in full operation. Our government recognizes Ontarians deserve more than a healthcare system that provides them with the tools to use illegal drugs. And today we are taking the next step to help more people get the treatment and support they need, to break the cycle of addiction and take steps on the road to recovery, giving them and their families hope back. The HART Hub model is based on existing integrated hubs in Ontario to connect people with the complex needs to tailor comprehensive treatment and preventative services in every corner of the province. Each HART Hub will reflect regional priorities and include a range of services to meet local needs. In Woodstock, our HART Hub will offer primary and psychiatric care, mental health and addiction services including counseling, brief therapy, assertive community treatment, addiction treatment, mental health emergency and response team, crisis services, rapid access addiction medicine, and withdrawal management. Mental and addiction supportive housing, emergency shelter, housing stability, eviction prevention, and housing case management. Income support, and family services and supports. All Ontarians, including those struggling with mental health and addiction challenges, deserve convenient access to care, support, resources, and treatment options. Establishing a total of 27 new HART hubs across the province is one more way our government is improving access to mental health and addiction support services that better reflect the needs of people and their families experiencing mental health challenges. Thank you again to Woodstock Hospital, Perry Lang, and all the healthcare workers and organizations in Oxford who over the coming months will bring the HART Hub to life. Thank you all very much for being here, and good luck. And I will, on the deadline, I will come and check. With that, thank you all very much. I want you all to look at the people across you and applaud for them. It's not the people up here that need the applause, and definitely not here. It's the people out there who made this happen. People saying what they needed and people working so hard to get all of us together. And I was telling the folks just before we started here, it's rather amazing. This is the first time that I actually have the ability to get a plan to deal with the homeless and the people on the street, that I could take to Queen's Park and say, if you give us the money, this is what we can do. And here we are, we got it done. So thank you all very much for what you've done.
Well, thank you, MPP Hardiman, for that great news. It's been a long time waiting for this, and the excitement level is just amazing, simply amazing. We're so grateful to our provincial partners for recognizing the need and taking actions towards addressing the challenge communities like ours have been facing for mental health, addictions, and homelessness. I'm pleased to welcome some of my fellow city councillors. I see Councillor Lauder, Councillor Schadenberg, Councillor Wismer Van Meer, and Councillor Tate in attendance today. So thank you so much for sharing this here with us. The province's HART Hub is exactly the type of model we had in mind when we identified a new priority action in our strategic plan at the start of this term. We knew that bringing together care partners in this type of collaborative approach was the only way we can make progress to address the growing issues. Already, as a community, we've been working together to support people in need. One of the key partners that we've been working with and who will help bring this HART Hub to fruition is Oxford County, and thank you to Warden Marcus Ryan for being here today. Through our Special Mayor's Task Force, we have reduced barriers to service, improved interagency cooperation, and now have a deeper understanding of the service needs and the gaps present here in our community. A HART Hub will have a profound impact on our whole community, not just those facing homelessness, addiction, and mental health challenges. Today's announcement means we can accelerate these essential treatment and recovery solutions. Because of the foundational work that has already been in progress, I know the Oxford, Ontario Health Team will hit the ground running to get this HART Hub operational. I know how much planning, coordination, and research went into developing the HART Hub application, and that the OHT has continued to move forward to advance solutions regardless of the outcome, so that those who need support will be able to get it. I'd like to say thank you to Hospital CAO Perry Lang for his leadership, as well as all of Woodstock Hospital Board and the phenomenal team working to bring this vital service here to our community. I'm so happy to see their efforts and actions recognized. I'd like to thank MPP Ernie Hardiman and Premier Doug Ford for listening to our concerns and the concerns of all the municipalities who are struggling to support those in need. I'd also like to thank Minister Jones and Minister Tobolo for their support and for their confidence in our team and the plan we put forward. I know we will step up to the plate and do our part to deliver critical care to those who need it the most. On behalf of Woodstock City Council, I look forward to continuing to advocate and to work with our provincial and local partners to deliver these vital services here in our community. I'd like to now turn it over to the Woodstock Board of Trust Chair, Patrice Hilderly, so we can hear more about their plans for the new HART Hub. Thanks for being here, everyone.
Oh, this is a great day, isn't it? Let me tell you. On behalf of the Board of Trust, I'm honored to welcome and thank Oxford MPP Ernie Hardeman and everyone gathered here today for this exciting announcement about our local HART Hub. When I think about the HART Hub and its impact on residents in Woodstock and Oxford County, one word stands out: hope. Hope is life-changing. For individuals facing homelessness, mental health challenges, and addiction, the HART Hub will be a place of both immediate and ongoing support throughout their recovery journey, a place where hope can be renewed. As a board, we are committed to champion forward-thinking strategies that enhance the health and well-being of our community. While today's announcement is a significant milestone, this project has been years in the making. Discussions about a community wellness center began in November 2023. It has been a privilege to witness the Woodstock Hospital, the Oxford Ontario Health Team, and our community partners work collaboratively to address local needs and design a plan for comprehensive wraparound care. This commitment is why the Board of Trust proudly supported the hospital's acquisition of 16 Graham Street as the site for the support, stability, and recovery phases of the HART Hub client. Its central downtown location is key for the accessibility of services. Also, it is near the community partners who will collaborate with Woodstock Hospital and the Oxford OHT to deliver the wraparound care individuals need to achieve their long-term stability. We are excited to continue this work together to ensure the Oxford HART Hub's success. We know that it is the strength of these local partnerships that has brought us to this pivotal moment today. Thank you.